Hi, I'm Dr. Mirafati from Mira Aesthetic. Again, we're continuing a series of video about breast implant and breast augmentation. So one of the next common question is that what is the most favorable size for breast implant? What is the most common size for breast implant? Now that's a very tricky question because if you ask me, I've done over 8,000 augmentation, right? So what is the most sizes I have done? Normally is between 300 to 400. But that doesn't mean that looks great on everybody, right? Because if you're smaller frame and basically a narrower chest size, then obviously putting something in 200 to 300 might look better for you. If you're a medium size, I think 300 to 400. And if you're a big girl and you have basically a big chest, then you want to be able to go to maybe 400, even 500. I have done girls up to 1 liter on each breast and they look really good because they're a little more curvier, they're a little bit bigger and they can carry the size of the implant. So when the patient comes to me and says, what is the most common size of the implant? It depends on your shape of your body. You know, what is your chest size? How tall are you? What is your curvature down here? How wide is your hip? Because remember, and also the projection of your buttocks. What is this projection has to match that projection? You don't want to be over heavy over here and have flat because it doesn't go with it. Or if you don't have a very curvaceous body, you don't have if your flank is not basically there and you don't have a nice curve, you put a big size implant, it's just going to be too big all over. So I guess is the relationship rather than just most common. But to answer that question, the most common implant sizes I have done in my clinic is from 300 to 400. But that's taken with a grain of salt. And obviously, and we're talking about in the last 35 years that I've been doing breast augmentation, right? But last year, frankly, when I looked at the statistic, we did more from 400 to 500. We're talking about the whole 30 years, but maybe the last year we got girls that are a little bit taller, girls that are a little bit more curvaceous, and therefore they can handle the implant. Like yesterday, we did a few breast augmentation and frankly, all of them were about 500. So, but they look great. They came this morning for their post-op and they look amazing. So it goes with the size of your body, not so much the size of the implant. So when the patient comes in here and asks me, what size should I do? My recommendation is I'll give them a recommendation. First of all, I measure their width, right? And I say, okay, this is the size you want to go. The bigger you go is going to go to your side. Obviously, when you're placing an implant, you can't just put it in the middle. So it has to have some separation in here in the side, right? And then we basically, the wider you go, it comes out to your side. So what we do during the pre-op at Mira Aesthetic is that I'll bring the actual implant sizes and you put it inside of a bra that we give you. And then you look at the sizes and you put on your shirt and you look at the projection, you look at basically the size and the width of the implant, and that's how you make the determination. You should not come here with a pre-notion that so-and-so had 375, I'm gonna put 375. That actually is a wrong thing. Whoever had 375, it could look great on them, but not on you. So when you go to my website, youngerlook.com, you can see a bunch of patients. We separated from 300, 400, 400, 500, 500 above. But again, when the patient look, I want that. Well, that picture looked great on that individual. That doesn't mean it's gonna look good on you. So I always tell patients, listen, just try it out. Put it under put it under the bra and put your shirt over it and look at it. And you determine what size looks great on you. Don't worry about what's the most popular size is. Worry about what looks great on you. So when you decided to come here, that's how we do our pre-op. I'm not saying anybody else doing anything that's wrong. There's another thing that I don't like. People sometimes do virtual imaging and they put this expense. We also had that too, by the way, a few years ago, and I stopped using it because it just doesn't show the true self. It doesn't show what it looks like on you. I think the best way after trying different ways of determining implant, we used to do water submersion and find out, oh, that's how much water took, so let's go up by 20%. But truly the best way after 35 years and 8,000 augmentation is that you come in, put an implant in, and just see the projection and size. That's the best prediction of what it's gonna look on you, minus about 10%, because remember, it's over the breast, right? So you wanna just take that with a grain of salt. So normally what I tell patients, if you like this size, go up by 10%, and that should be pretty much the shape you're gonna have when you're actually having the implant. So stay healthy, stay safe, and God bless you.